You are listening to the Veterinary Project Podcast, episode 058.
Welcome to the show created by vets featuring absolutely no pets. This is the Veterinary Project Podcast, hosted by Dr. Michael Bugg and Dr. Jonathan Light. Our resident veterinarians have swapped out their stethoscopes in favor of microphones to bring you the Veterinary Project Podcast, a show focused on real conversations, aimed to connect this amazing profession full of remarkable people. Through the sharing of collective stories and wisdom, and connecting over the many unique challenges we face, we invite you to join our community of veterinary professionals leading intentional lives. And now, here are the hosts of the Veterinary Project Podcast, Dr. Michael Bugg and Dr. Jonathan Light.
This is the Veterinary Project Podcast. You are once again joined by Dr. Jonathan Light and Dr. Michael Bugg. Mikey, what's shaking?
Oh man, your intros are always so ridiculous, like different tones and pitches, but I love it. I don't know what I'm gonna get. So
Gotta switch it up. It felt like a day to switch it up. I've been pretty bland the last couple. How are you doing today?
Doing well. That was a fun conversation. These are always fun. You were leading this one. You had organized it, did the pre-recording. So I'm jumping in, and it was funny. It was like with Kate. That did not feel like the first time the three of us were all chatting. That was one of those conversations that was very natural, just seemed to flow. So had a great time with it.
Agreed. For anybody that is looking at what quality of life can look like when you are willing to go outside the normal bounds or the expectations in veterinary medicine of living a day-to-day clinic life, you are in the right place today, because we're going to walk through Kate's journey and what she's doing today as ClinPath Kate, as you can find ClinPath Kate, as you can find her on Instagram. So, yeah, great conversation, and one that we will not be finishing today. We'll have more with her. That's for sure.
Yeah, absolutely.
Excellent.
Other than that, I forgot. I don't know if I've even ever mentioned. I know we've talked about I'm writing a book, and I kind of got stalled. It went off to content edit, so it's like another set of eyes goes on and they rip it apart. And that just came back. I got that back the other day. So yeah, that's a kind of a cool landmark, but it's also, at a quick glance, there's a lot of red on it. There's a lot of edits that need to happen here over the next while. So my October is going to be lots of research and trying to fill in all the blanks that the content editor has pointed out.
Buddy, I'm so excited you've just put this out on the podcast. This is not a setup and pre-recording.
Well,
We've not talked about this for a long time.
I know it kind of got like, because when it went off
side.
to edit, like, and I forgot about it over harvest. And they said you need to step away, forget about it, don't think about it. And I didn't. And now it all comes back. And so the next month is full on. There's going to be, like, I'm thinking over 100 hours at least, like getting into to get it to the next phase. But I'm excited. It's been a fun journey.
And I'm sure there are others that are listening right now that are going to want to know that journey of writing a book. So we are going to put you on the hot seat, because I want to ask a whole bunch more questions, but that would defeat the purpose of this conversation today with Dr. Kate Baker. But buddy, we're going into that further.
Okay, we'll shelve it. What's happening your way? What specifically, you said some things around Bridgeland. Things are going well with the team.
Yeah, we are almost at month 2 since startup, and a couple of events happened yesterday at the hospital, at the clinic. Sorry, I should be saying, and it just made my heart so big. And I had walked in 5 minutes after actually a really bad situation where we had a dog arrest during a dental prophy, and the team there stepped up to the plate. They were able to bring the dog back very quickly, and just watching the team work, and just literally, this was our first event where we had some complicated cases the last couple of days. They were able to step up to what was a really big challenge, and to watch the team come together, do what needed to be done. And I'm talking everybody in that room, everybody on our team was involved. It was just, made me proud, and I just felt fantastic, and had everything going right about it for making sure that we're able to look after that animal in a situation here where we're still uncertain the next day as to what had occurred. No medical error, but these things do happen. And so I think we're gonna look at it afterwards and make sure that we have everything possible we can for the next time, because there always will be a next time. But for 2 months in, ensuring we have all the processes we need to ensure that our pets are looked after is a proud moment.
Good. Yeah, it's nice. It's not nice to have hurdles like that, but always nice when you can navigate them and get to the other side. And
we're in the veterinary clinic. This is going to happen. There are events that happen that you cannot foresee, and it's the training and set up for whether you're going to be successful to get that animal back. This is one of those times. So yeah, really happy with it. Changing gears a little bit, it is time for a quick tip. Mike, what do you have for today's quick tip?
All right. So today's quick tip, kind of inspired by Kate. After the recording had stopped, we were chatting. She had mentioned a book she's reading, and I've said it before, The Psychology of Money by Morgan Housel. Amazing book. And also in our conversation with Kate, we'll get into it. I was going to ask her a question, but I felt like it was unfair because I don't even know if it can be answered. And she was talking about how amazing it is and how amazing it feels to have the freedom that she has in her life, right? And it reminded me of this quote from this book. And the quote is, "Wealth is what you don't see." And so that's my quick tip for today, is wealth is what you don't see. And what I mean by that is this can be taken two ways. In relation to the conversation that you're going to hear with Kate, the wealth, the richness of having that time freedom and control of her schedule, you don't necessarily get to see that, right? That's just like a feeling that comes with it. Taken more literally from the book, wealth is, the Ferraris that were not purchased. Whenever you see someone driving a fancy car, all you know is they spent money on that car. Whether they had the money or not, you don't know. They might have just signed some paperwork. But anyway, that's what jumped out to me in chatting with Kate. Wealth is what you don't see, especially that freedom piece that really, really spoke to me.
I see a short episode coming up specific on this topic. But in the meantime, let's move over. Thank you very much for your quick tip, Mike. We are going to go into some details later on. In the meantime, we are joined by Dr. Kate Baker today. And Dr. Kate Baker grew up in Nashville, Tennessee, completing her DVM at the University of Tennessee in 2012. She then completed a rotating internship and clinical pathology residency, becoming board certified in 2016. Dr. Baker currently works as a veterinary educator and diagnostic clinical pathologist. She's the founder of the highly active Facebook group Veterinary Cytology Coffee House, offers continuing education and resources through her website, Veterinary Cytology Schoolhouse, and recently launched a personalized telecytology consultation service, Pocket Pathologist. She lives on a small farm in Columbia, Tennessee, with her husband and 2 young children. They have 3 dogs, 2 chihuahuas, and a cavapoo, a mini donkey, a pygmy goat, and 30 chickens. Without further ado, Dr. Kate Baker. Kate, thank you very much for joining us this afternoon. We are very excited to have you on the podcast. If there is any setup for this conversation this afternoon, it is the first 10 minutes of laughing that the 3 of us have already all partaken in our pre-recording setup. I am excited for where this conversation goes this morning.
Me too. I'm super excited. Thank you so much for inviting me. It's been fun already, and we haven't even gotten into it.
That's right. Well, let's get into it. Goal for today, and Kate, I think a place to start is, where have you journeyed to get to this place in your career, which in our pre-recording you discussed being in such a happy place today?
Yeah, it's been a little bit of a weird progress to this point, but it's been really cool. Weird is not always bad. In fact, tangent already, I have a tattoo that I got when I was 16 that is Japanese symbols, because that was popular then. And it is supposed to say unique, but I later on had a Japanese friend that said, no, that actually means strange or weird. So that's kind of just been my life.
This is not surprising me at all.
Now we've got this out in the first minute of the podcast. is even better.
Right. Yeah. I embrace it though, but yeah, it's just sort of been the trajectory of my career. It's just been a little bit off of the mainstream. So I actually went into veterinary school planning to be a pathologist. I really enjoyed learning about disease when I was younger, even before veterinary school. I took some courses in undergrad that I got really interested in, things like histology and molecular biology. Prior to that, I had been more interested in the traditional role of the veterinarian. I worked at the veterinary office and did all those things. And I was always interested in like the excitement of the day. I was specifically interested in just watching like the emergency process. And I'm jumping ahead a bit, but I'm still interested in that. I'm married to an emergency veterinarian and previously worked inside of a emergency and specialty hospital and would always come out and watch, all the things going on in the ER, but I never wanted to be the one doing anything with it. I just wanted to watch, like I was watching a television show. But yeah, so before vet school, I planned on, I really developed an interest in the specifics of disease and how disease develops on a molecular level and how the organism can be affected. So I was like, okay, well, how can I combine this with my interests prior to this in veterinary medicine? And so I started digging and realized that veterinary pathology was a career even before vet school. So I went into vet school and the whole 3 years planned to do anatomic pathology. So for people listening that don't know, there's two types of pathology: clinical pathology and anatomic pathology. Anatomic pathology is more of necropsy, dealing with whole tissues, and then histopathology, versus clinical pathology, which is what I do now, is cytology, hematology, and clinical chemistry. So I had been planning to do anatomic all the way through until I got to my 4th year, and I really enjoyed clinical pathology. I still love anatomic pathology, and my professors were disappointed, because the ones that I had, my mentors throughout the whole time, were anatomic, and they were like, "What are you doing? Why are you going to the oily side?" But I loved the idea of being more like involved in a day-to-day basis with the clinician and ongoing cases, and cytology was really fascinating to me. So anyhow, I finished vet school with the plan of pursuing clinical pathology residency. I ended up doing a small animal rotating internship that I had not previously planned to do. Just life circumstances ended up where that's what happened. Okay. And I struggled.
She's giggling already.
I struggled. I'm good friends with, oddly enough, my husband now is an emergency veterinarian for the hospital I did my internship at. So I'm friends with their specialists. At the time, I had a hard time. And I think it was because I had never planned to do anything clinical. So even though obviously I learned those things in vet school and I studied to pass the tests, I never really felt committed to learning that. Yeah. And I also had a really healthy dose of imposter syndrome, which I know many of us do. Mine ended up being quite paralyzing. So for the first 6 months, I was like, I think they were like, who are you? I remember at one point, one of the doctors was like, are you sure you graduated vet school? Like, he was teasing, but I remember that. And probably was not the nicest thing to say at the time.
And do you think that was because you weren't able to open up as much as you wanted to, and you just said, "Hey, I've got to pretend I know it all"?
Yeah, I think so. I mean, and I felt so insecure about just everything. I felt insecure about my knowledge base. I felt paralyzed in like, is this treatment that I'm administering the right one? And I mean, I even got kind of extreme where I was just doing almost an OCD type thing, like rechecking my, which I don't have that. And I know that's a real thing. So I don't use that term like lightly, like truly I would go back to my treatment sheets and triple and quadruple check them and do my math a bajillion times, because I'm just not a math person. Even the simplest of math just freaks me out. So yeah, I mean, I felt really insecure. And so what happened is halfway through my internship, I mean, I was really struggling. Like, I really was like, I don't think, because I had always been so used to just being successful and, getting good grades and not being considered the low man on the totem pole as far as like how you're performing. And I was like, I might need to quit this internship. It was around Christmas, and I just thought I'm like a drag on everybody else. I mean, I had a lot of really like strong personal, just this like internal conflict. Well, I talked to my mom, and basically I ended up saying, okay, she said, don't quit and just go in there. She told me this story about how she made it all through junior high pretending to play the flute. Like, she didn't actually know how to play the flute, but she pretended the entire time. So she would go to competitions, and like nobody ever knew that she actually didn't know how to play the flute for like years. So she was like, just go and just fake it. Which, the good thing about this is that you really don't want to just fake it like as a doctor. But what that did is that it made me realize that I don't have to fake it. So even though I felt like I was faking it, what was really coming out of me was like the knowledge I actually had that I just didn't have the confidence to put forth. Yeah. So I really just like reset my mind, and I was like, I'm going to go in there and I'm just going to completely be a different person. So I really actually like manifested this different being. It sounds weird, but I did. And I just went in and I told the specialist, I was like, it's on, we're about to do this. And I distinctly remember them being like, what happened to you? Because you're like great now. Like you're doing a great job. So of course that made me feel good. But anyway, so
sorry, Kate, this happened just over a Christmas break.
Yeah, basically. Yeah. Cause it was just the breaking point. Like I just couldn't, I had to decide, like what I was going to do. And I'm not a quitter. I didn't want to quit. I've never quit anything. Well, that's not true. I mean, I quit like softball when I was young, but something this important, it was actually like a pretty critical point. And so I didn't want to quit, but I just felt so uncomfortable to the extreme. But yeah, it just really turned around about halfway through, and I got the superlative of most improved at the end.
So you set yourself up for that. That's what
right. That's right. I was still operating on a pretty low level, but anything wasn't improved. No, it was cool. It was cool introspectively just to say, okay, I am capable of this, even though this isn't my interest. I am 100% sure now that I do not want to practice. Because really my whole professional interest is diagnostics, obviously. And my interest pretty much takes a screeching halt at diagnosis. Mm-hmm.
It's interesting that you say that, because there's so many that are in school that are concerned that, hey, I've got this specific thought process to go in one direction or another. I was one of them. I knew where I wanted to go pretty soon into school. And that does separate you out from many others. And you can be blacklisted in terms of looking different than the norm. Did you feel that in vet school at all, knowing that you already had that
trajectory? Yeah, no, I don't think. I kind of embraced that uniqueness or weirdness. I was fine with that. I was so invested in pathology that I just, I definitely didn't have, I didn't make good grades like on my cardiology tests, because cardiology is about as far from cytology as it gets. There's like hardly anything that happens cardiology wise that is important to a clinical pathologist. But yeah, no, I was pretty okay with it. But I mean, I think that it's normal, like you said, to not be okay with it or to feel uncomfortable, to say, is it okay that I'm following this particular path? And my path was very different. I mean, most people don't know exactly what they want to do. And even if they feel like they do, they may change their mind, and that's okay too. So yeah, it's just different strokes.
So then moving forward here, you go then into your residency.
Yep.
And you move through your residency. This is a 3-year residency.
Yep. 3-year residency at University of Illinois. So I went from my internship into my residency, which you don't actually have to have an internship to do a pathology residency. So that's why I say I'm glad I did it, because people listening might say, well, don't you have to do one? And you don't. Yeah. But I'm glad I did, because I really gained, even though it was just a year, I got a good appreciation for what clinicians see and deal with, and those money conversations that nobody likes, and knowing that, in myself, when I write my reports and stuff, I can be more conscientious of that when I'm giving the primary veterinarian advice in my interpretations. But yeah, so then I went into my residency and I was a complete rock star. No, I'm just kidding. Kidding. Totally opposite of internship. No, I loved my residency. My residency mentors were amazing, they're friends now and still mentors. But yeah, it was great. I mean, I loved it. 3 years. Yeah.
Briefly on that, is there something that you did different in setup for your residency that set you up for that kind of success? And the feeling and the look I see now in your face is to describing that residency.
I don't know that it necessarily was anything I did. I wish I could give myself credit. It was more of just that this was what I wanted to focus on. You know, I didn't want to be the jack of all trades. I wanted to be really knowledgeable about one area, and that's where I felt more comfortable. And I was obviously specifically interested in this area. So it was more of just I'm super excited to be able to dump everything else out of my brain and just focus on this, which it's not that there's less, there's tons, you know, that's becoming board certified in that area. It doesn't mean, it's just, you know, nothing, but it's focused. And my brain really likes that.
I would say that. So then you finish your boards in 2016.
Mm-hmm.
You start work with Antec, and you work with Antec for almost 4 years.
Yeah, just about 4 years.
About 4 years.
Right around there.
And during that time, describe for the team, and I want to switch directions a little bit here, describe for our listeners what happened in that interlude in terms of the setup for what right now is a completely different career.
Right. Yeah. So my time as a diagnostic pathologist with Antec was great. I really enjoyed my job. I was really lucky because I was able to be housed in an emergency and specialty clinic, like I mentioned. So that was really nice for me because I really like still being, like I said, part of the veterinary team and not being physically away. So that was really, really nice and fulfilling for me. And also I got to work with my husband, who I really like. So, so that was fun. But yeah, I felt really like I could come out of my office and talk to the clinician and get more information and bounce ideas off. And it was just a really professionally fulfilling environment. I had quite a high caseload, as you tend to do in diagnostic pathology. Yeah. So, but what that did is that it taught me efficiency even more than I had already had before, which came with some, I'm not going to say it was always a cakewalk. Like it was hard, when I was in the beginning and I was trying to get used to that caseload, it was like, whoa, but you develop systems to fix that, or to do better with that.
And for those that don't understand, because we get the backlogs or we get the delays on getting results back from specialists now through consultations, et cetera. Mm-hmm. What was the expectation generalized to how many cases you'd be running through a day? What would that look like, Kate?
It depends so they were good about working with you and your comfort level and your efficiency, but obviously there was expectations too, because it's, you can't be like, well, I'll take 5 cases a day and be done. So for me, I got to the point where I was reading about 50 to 60 cases a day, which is a lot. But again, you really work systems into that.
Yes.
Because what I never wanted to do is have so many cases that I felt like the quality of my work was affected, because my oath at the end of the day is to do the best job I can for the animal. So if I ever felt like I was stretched too thin, I had those conversations with my boss. But things like dictation software and seeing 10 mast cells a day, sometimes, 10 mast cell tumors, you get a lot quicker. Yeah.
And it was during this time, and we discussed this in your pre-recording, that you realized how much you missed teaching.
Yes.
And that was the impetus for going outside the norm again in your uniqueness. And tell us a little bit about that compared to your residency and where your group on Facebook then started.
Yeah. So in my role with Antec, I had that high caseload. I got a ton of experience and was exposed to a lot of different case types. And I remember when I first started thinking, like, this is so cool. Look at what I'm seeing. This is amazing. Not this 20th lipoma, but they're not all those. I would get any type of case. And I wanted to show people. And my husband was only willing to be dragged into my office so many times
a day.
Right. I mean, he's busy. He's like, cool, Kate, gotta go. Dog's dying, and I'm like, but look at this, like histoplasma. Don't you care? No, I understood, but I really just wanted to share, it was just like, how can people, like, this is just such a waste for only my eyes to see this. So I started this Facebook group, the Veterinary Cytology Coffee House, and the whole idea around it was simply to share those cases with veterinary professionals. So look at what I saw today. Here's a little bit of teaching associated with that. Because back in my residency, it was very teaching heavy. And so I developed a knack for teaching, a confidence in teaching. I was not always confident initially, and I still am not. I'm actually enrolled in I shouldn't say I'm not confident. I'm open to the fact that everybody can get better, so I'm enrolled in a veterinary teaching program at the Royal Veterinary College now, just because I want to be even better. So, but yeah, I took that from that residency experience and said, I really just want some teaching outlet. So didn't really know how to do that. So started this Facebook group, and it really just organically developed into this really rich space of veterinary professionals joining, which there's a lot now, which kind of emphasizes how much people need this, that need this exposure and need this somebody to help. And so, it's just sort of developed over time. And so I post cool cases there, and other people post things there, their cases too. The goal of this Facebook group is not to be a free diagnostic board. It never has been that. The intent of it has never been that. And I've put systems into place to try to help prevent just that, Yep. Yeah, but I recognize, but I have really respectful members. It's an excellent learning environment, and I love it. I really dig it.
And something that I thought was so cool in our pre-recording is talking about the culture within this Facebook group that you've created. And just for all of our listeners, there's 60,000 plus Facebook community members. They must be veterinary professionals to be part of this group, correct?
Yes, that's right.
And one of the direct questions I asked was, who do you have moderating this group? How do you deal with that? And can you share a little bit with the listeners how you handle this? Because this is a personal affair here.
Yeah, it is. So it's me. It's me and my husband. He helps out too. But really, it has been self-moderated. It hasn't been as big of a job as you would think. It is a big job. Don't get me wrong. But as far as what you think of like traditional moderation, like making sure people aren't being crappy and making sure that people are being nice to each other and all those things, that only very rarely comes up. I mean, very rarely. And I don't know that I know the exact reason, but I think that a big part of that is that this culture has been established in this group. This is how we act here. This is a judgment-free, safe learning environment. And I emphasize that over and over. So people hear that over and over, and, they can hear that and think, ooh, okay. But then they have to actually experience that.
Yes.
And so I just watch it like a hawk, honestly, just to make sure. And like a hawk, I should say, I don't feel like I have to do that much, because people they'll flag anything for me that they think is inappropriate or just mean-natured. I just don't tolerate it. If you're going to be a jerk, you get kicked out. I have no problem with that.
Yep.
But in the nicest way, right? So I'm not like, get out of here, but I'm like, this is just not what we do. Like, we just don't act like that.
Tolerate that. Yep.
Yeah.
And there's a lot of vet clinics that
simple.
can take examples from that for clients and situations, et cetera. And there's always flexibility, but at the end of the day, it's home for you.
Yeah. And it's okay. Like, people have bad days and they may act out, but if you're going to take it too far, it just depends. Like, there's a few situations that have come up that I've had to usually I talk to the person first. I message them and I have a conversation, and this is, a lot of work for me. So I don't, luckily it's not all the time, but the times it has come up, it's just conversational based, and it might be like, hey, don't do that. Or like, let's talk about the rules or whatever. But then, if it just goes too far, then
there it goes.
It's just not the place for them.
Excellent. So then you take this Facebook group where you wanted to share, you wanted to be able to teach and move forward, fast forward. what is Kate doing today? Because I was really excited about this. And I think our listeners are super into the different ways of both monetizing what you know really well and creating a life that makes sense for a family change for you, a geographical change, and also direction in career. Share with us that part, because I think it is so impactful to those that are listening.
Yeah. It's been amazing just allowing things to happen. And it's not all passive, but just paying attention to the opportunities that are not traditional and pursuing those and just cracking that door and then going, wait a minute, there's something here. And ultimately, at the end of the day, and I'll detail this, but at the end of the day, with the career I have now, working for myself is amazing. And just to know that you can create a job, and I shouldn't say you, because I know that this is not the scenario for everybody. There are different, I mean, people may be thinking, well, I can't because I'm, my family situation or medical, something. So it's not that it's just one size fits all, but if you're in a position to be creative about your life and your job, this is just one thing I've recognized over the past years and where I am now, is that you do not have to just wait for somebody to offer you a job. Yes. And you don't have to just accept a job that's offered to you without any kind of negotiation or discussion about what that's going to look like. So to back up, just to answer your question, I now work for myself. So out of the Facebook group, I had never intended to be my own boss. But naturally people said, hey, do you have CE? Like, I like the way you teach. Do you have any kind of CE courses? And I was like, no. At the time I had one small son. I have two babies now. Well, a 4-year-old and a 1-year-old. They feel like babies to me still. But at the time I was just working full-time, had my full-time job and family. And I was like, that sounds really fun, but I have no idea how I would do that. And I sat on that idea for about a year until people just kept on asking. I was like, well, I'm going to just do this and I have no idea what I'm doing. I'm just going to do the best I can. Yeah. And, I'm going to record these courses on QuickTime, like nothing fancy. And I'm going to upload them into this educational software stuff that I found. It's not anything complicated. Make a little website and sell these courses because people are asking me for them. And I can see how there's such a huge gap in people's comfort level and education. And that's not a knock on the schools. There's just only so much time in this area. So they need it. And so, I'm just going to, it took a lot of time. So it's, and I do a lot of free education too, but these are paid courses. And so I was like, okay, I'll just try this. So again, with no intent to make this a career, but just a little side fun project. And a lot of people bought it. And I was like, well, okay, this is cool because 1, this is supplementing my income, and who doesn't like that? And 2, it's helping people. Like, what better job to have, that you're able to do that. And again, at that time, it was never an intent to be a full-time thing. So another course came because people were asking for a hematology course. And then my membership now I have is a monthly membership. And what happened is basically, long story short, we ended up moving back to Tennessee, and I was not able to make it work with my prior job to continue working in Tennessee. And I thought, well, maybe I should try to make this my full-time job and see what happens. And so I was like, worst case scenario, it doesn't work out. And I'll figure it out. I'll do something else. And so far it's been almost a year and I've been doing well. I'm comfortable with the, job aspect of it, but what's even just more exciting to me is just waking up and making my own schedule for the day. I'm very busy, but it's the busy I want to be. And I know that all the things that I'm doing are geared towards helping veterinary professionals learn cytology. And that just is, it sounds corny, but it's just so fulfilling.
And it's filling your boat. It's helping you guys out economically. We're recording where you've got a basketball in the background there. I think it's a basketball. And then you also have your husband that's working in the veterinary field as well too, which I bet is just such a great bounce off and that collaboration piece. And
it is. Yeah, but we are, I forgot to mention, so because of the flexibility and working for yourself, and my husband is going to move to Relief, and we bought an RV, and we're going to go travel in 2022 and just work from the road. So in my head, this sounds like a really good idea. I have no idea how it'll work out in practice with two small kids, but this is kind of how we're living our life now. Just try to do stuff, and if it's like that was a bad idea, then just stop.
You're like so many people, and I unfortunately, this is so hard. I have two parts of me that says this, because we need more people in clinics as well. We have a veterinary professional shortage in clinics, but the bigger part of me goes, I clap hand, because you're taking something that you have started as a project and a passion project and said, now this is fulfilling both my professional life and commitments to my profession as well as to my family, and we're making a goal of this. How could you ask for better? And sometimes that doesn't mean you need, actually many times that doesn't mean you need to be in clinics to make that work as a veterinarian, which is so strange.
Yeah, and there's so many variations of this too. I mean, it's not like, well, first, I just want to make sure everybody listening understands that this is, I know this all sounds like, well, good for you. That sounds great. It is great. I'm thrilled with where I am, but it has been hard. And I've done a lot of work before now that I didn't, I enjoyed, but wasn't the where I wanted to be. And I didn't even see it at the time. I wasn't running away from anything. Yep. I wasn't running away from a bad job. I just found something that was more fulfilling to me, that I just went for. But you can piece this together in any way, that you're able to, or that you can envision for yourself and try for. Now, again, family situation dynamics and that kind of thing can play a big role in this for people, and location. So I don't want to make it sound easy, but even like with my husband, he loves emergency medicine. He is not trying to get away from it. And it's been really I've been pulling him going, let's just try this for a year, because our son's going to be going into kindergarten. We're going to lose that opportunity to travel heavily. So we're just making it work. He's going to be working Relief. Not, he'll probably be working the same amount of time, but just structured differently. For me, I'm going to be working on the road. We're actually planning on combining some of our trips that we have planned with speaking events. So I have several things planned in 2022 that I'm going to be doing, like a 4-hour speaking event, and then I'm going to go back to my camper, Literally. So it's, So just making it work, making whatever you can work. Hasn't always been easy, but it's just, I'm very happy with where things are now. Yeah.
And something that I also respect, and also I think needs to be pointed out, even for the setup for this meeting, and we talked about this in pre, it's not just you. You have 3 VAs behind you. You have one main assistant and a couple of others that you've built up over time. I know Mike and I bounce back and forth as to how do you make this lifestyle that we've chosen as efficient as possible so that it's not on your own shoulders. My guess is that didn't happen overnight either.
Oh, no, it didn't. And I felt funny getting VAs, virtual assistants, because I don't know. I just thought, like, who has virtual assistants or assistants at all? Like fancy people, I'm not a fancy person. But once you start that process, it's difficult to stop, because what happens is you realize you can maximize your efficiency to then enjoy the life you're creating, on purpose. So instead of working 60 hours a week on my stuff, I can work a regular schedule and have somebody help me do things that I don't necessarily need to do. I still like to answer all my emails from people. I don't really like somebody else answering my emails, but there are things like having issues logging into the courses or something, if that ever comes up, or helping me with my schedule, because now that I'm doing a lot of speaking events, just making sure, asking her to help me make sure that they're on my calendar and I don't forget them, and sending out Zoom links and just little things, Yep. And now I'm like, everybody, I don't care if you don't have a business. Like, I don't care if everybody should have an assistant. It's just, I don't know, it's probably a little much, but it's not just me. I have a lot of help.
Awesome. Mike, anything to add to that? You're preaching to the choir to Mike here.
I've just
gone back and forth on this. Smiling
so much, Kate. And I mean, for people listening, I'm sure they can hear this coming through, but if you're watching on YouTube, like, Kate, you're beaming, right from before we even hit record, when we were just bantering beforehand, Like
I'm talking to two very nice Canadians. I mean, how can you not?
But I don't know. I'm so happy, when that this podcast gets to go out, and veterinary professionals can see, like you're living a life of such fulfillment and alignment. Like it's so possible. And so I've just been smiling the whole time. That's why I haven't been saying much, but
yeah, I know that it's hard. I mean, I like I said, I just want to be very conscientious of just the situations people are in, and especially the state of veterinary medicine right now and how it feels, because I am not oblivious to that. I live with that in my home through my husband, just that pressure of what's happening, especially right now. So I'm not unaware of that. And it takes a lot of, family discussions and how much should you be working versus how much should you take for yourself and your family, and finding those balances. Those are discussions that happen at our house all the time. No, you can't stay until 7 o'clock because I can't walk and our kids are coming home, and because for people listening, I was in a car accident and I broke my leg. And so, it's just like these little logistical things that, or maybe you're working too much and that, but you feel the need to help in the veterinary field right now. And that is not an easy thing to figure out at all. We're dealing with it too. But I think once I don't know what the answer is, but I do appreciate you saying that it's nice to see an example of a fulfilled person in this field, because it is possible. Now, if pathology didn't exist, I probably would have made a big mistake. Because I don't know that, not that there's anything wrong, but for me, I feel like this is just where I belong, and I shouldn't say mistake. I have done some vaccine clinics, which that's a whole nother discussion. I don't want to irritate any of the veterinarians listening, but I was like, I want a little bit of clinical practice in there still, and maybe I'll go do a couple of vaccine clinics. And I was like, I'm not cut out for this. I was like texting Will going, and I did all this research beforehand, just to remember all the vaccine schedules. And it's like, I don't want to get a puppy exam. Like, I don't know anything about puppies anymore. And of course, the first one I got, and it's not, an exam because it's just a vaccine clinic, but of course they're going to ask questions. The good thing about that is you can be like, go to your general veterinarian. Like, I'm just giving your dog a vaccine. I don't know anything about dog food. Don't ask me. Does he have any, Demodex that I can look at in the microscope?
It's so interesting you mentioned that, because many specialists I talk to have the exact same comment that you have. It's so interesting to hear, because the specialists are like, I don't know anything about anything except for in this very narrow field. Mm-hmm. And then the general practitioner, me being one of them, goes, I don't know anything specific about anything. I can give you the general jack of all trades version.
But isn't it amazing how it just is so cohesive in that way? There is a spot for everybody, and nobody, I know I'm getting a little bit off here, but like, nobody is better than anybody. And I want to make sure that I emphasize that, because that's one thing in the specialist realm that I feel like not even necessarily the specialists project that, but there may be, from a practitioner's standpoint, like some intimidation there sometimes. No. and if you've experienced that because of an experience you've had with a specialist that's been acting like that, it's not right. We're all just doing this to help animals, period. Like, I went to a little more training to do this one thing. That's it. Like, I'm a veterinarian too. So I'm
having our producer quote that right there.
Well, it's sad that it has to be said. It's sad it has to be said, but I know how it is sometimes.
Leaving my comments to myself. I completely agree with you. So on that note,
let's all be friends.
And you know what? We are all friends. We are in this profession for the right reasons. We all went into it for the right reasons, and we have so much to grow with together. And it's conversations like this that keep us really fulfilled and uplifted towards what's possible, considering the challenges we all have with us. And that's one of the reasons Mike and I started this, to ensure that we could have these positive conversations. So with that, we are going to switch gears into what we term our impact round, Kate, where we're going to ask you a number of short questions and have you answer as you so please. So our first question,
very verbose, so I'm going to try to keep it short and not expand. Okay.
Let's try with the first one.
Okay, I'm ready.
Cat, are you a cat or dog person?
Chihuahua person, specifically.
I'm going to keep it short.
Always chihuahuas all day.
True or false? I knew I wanted to be a veterinarian since I was a kid.
High school.
High school. All right. How would your friends describe what you do for a living?
Most of my friends think that I work in a GP clinic.
Yep.
That's what they envision me doing. Yeah. I think their heads would explode if I tried to explain more. So I just leave it at that.
Safer. What is your favorite hobby?
Photography.
Nice. Nature, city, anything?
People.
People.
Portraits.
What in this world are you most grateful for?
Definitely my health, especially after my car accident, and my family's health.
Yeah. All important. Well, we got through that. You did very well on the keeping it short part. You did
Is that
very
it?
well on that.
Yeah,
That's
that was
it.
Right.
Pretty much. That's a record. That was the fastest impact round on history.
That took everything in me not to keep talking. I have a problem.
Well, Kate, this has been a pleasure.
Yes,
Really enjoyed it. We could take this conversation so much further, and hope that we one day have that ability to do so. There are going to be a number of individuals that are going to want to seek you out. I already tested you at the start of this conversation in the pre-recording. If people want to learn more about your skills and what you're providing to the veterinary profession, where do they find you?
I'm in a couple places. So I'm on Instagram at ClinPathKate. And I have my website, which has all of my learning resources, both free and my paid courses and membership, which is www.veterinarycytologyschoolhouse.com. Long URL, I know, but
perfect.
Yeah, and on Facebook, the Veterinary Cytology Coffee House. That's for anybody who's a veterinarian or a veterinary technician.
Fantastic. Thank you very much, Mike. Any words in close? Yourself?
Just thanks, Kate. This was amazing. It's funny you see someone online, like I've only seen your social media presence, and then when we get to connect and chat in person, I mean, this was fun. This was a really fun conversation. And we're going to track you down in your RV a year-ish from now. Check in, see how that's going. That sounds amazing. I'm really pumped for you guys to be taking that on.
Thank you. I am too, and I really appreciate you guys inviting me. This has been a blast.
I've got an idea for a live podcast in Kate's RV in 2022.
Oh, I've already been
conference that we're all in together.
Yeah, I'm like, should I make a new Instagram account for my RV travels? I mean, I already have that, but we have chickens and I sell eggs, and we have a totally different farm page. I'm like, I don't need another social media account.
I'm picturing more of like an RV wrap, like your whole RV, ClinPath Kate.
I like it.
Schoolhouse, just on wheels, rolling across the U.S.
I think you're onto something. You're giving me
Ways
ideas.
to pay for this. There's business deductions in the works right here.
That's right. Talk to my accountant.
So in every conversation, Kate, the last word belongs to you. What message do you want to leave for the veterinary community?
I would say you are doing a good job, and I'm proud of you.
Thank you for listening to the Veterinary Project Podcast. As a recap, on behalf of our hosts, the Veterinary Project Podcast will be releasing new episodes weekly, so be sure to tune in as we bring you more conversations aimed at helping you enjoy a life well lived. If you enjoyed what you heard on the show and you want to stay in the know, please like, love, and or subscribe to the podcast on the listening platform of your choosing, as we're available on all the usual suspects. If you know of others that may benefit from these conversations, we'd love it if you please share the show with them, as this will help us grow our community to reach more and more veterinary professionals. Speaking of which, if you are a veterinary professional and would like to get connected with more like-minded individuals who are joining us on this journey, please send an email to the veterinaryprojectpodcast@gmail.com, and we'll invite you to be a part of our private Facebook group. General feedback, requests for information, or perhaps requests to be a guest on the show can also be sent to the veterinaryprojectpodcast@gmail.com. Dr. Michael Bugg and Dr. Jonathan Light, thank you for listening to the show, and we'll catch you again next week for another episode of the Veterinary Project Podcast. Bye for now.